Today, we're going to talk about two really interesting topics that I get a lot of questions about: menopause and thyroid health. And if you don't know me, my name is Dr. Lori Marbus. I am a double board certified family and lifestyle medicine physician, and I have helped thousands of people across this nation, as I'm licensed in all 50 states and DC, find their better health. And today, I have a really special connection with this topic. One, because I was diagnosed with Hashimoto's 28 years ago with the birth of my second child out of my three. And I'm going through that menopausal stage. So in my midlife, in this mid-50 range, lots of things are changing. Even though I'm living a very healthy lifestyle, I practice the best of my ability, everything that I preach to my patients. And things still happen, right? Your body still changes. These hormonal fluctuations still occur. And as I mentioned in yesterday's video, I talked about 30 different symptoms of menopause and perimenopause. So if you have some questions or thoughts about what might be going on in your body, check out that video as well. But today I wanted to mention some things that happen as you go through this menopause stage and thyroid. But I wanted to share with you also, when I was diagnosed with Hashimoto's, within months of my baby being born, Jonathan, some really interesting things happened, right? I had fatigue and all the symptoms of hypothyroidism. I went on, took my medication with escalating doses over the first 15 years of my diagnosis. Then, about a little over 12 years ago, I found a whole food plant-based diet. My thyroid improved to the point that I was way overdosed and started having symptoms of hyperthyroidism. So now there's been, pretty steady decrease in, maintaining on my medication that I've been on for all these years until menopause happened. And then my thyroid went a little wacky again. And so, I'm back down to where I was, but there's some interesting things that occur that you should be monitoring. And so we'll get to that in a minute, how you can participate in monitoring your own thyroid. But first, I want to highlight some of the changes that occur with your thyroid health during menopause, having experienced them myself. So, number one, so remember, for those of you who don't understand what Hashimoto's is, that's an autoimmune disease that affects the thyroid, right? And it's most common in women, actually, it's more common in women of menopause age. I just happen to be post-pregnancy again, which is another common stage for autoimmune disease to strike. And once you have one autoimmune disease, you're more likely or more at risk to develop another autoimmune disease like lupus or MS. So really important that we pay attention to the factors, one, that initiated it to begin with, and two, the factors that can actually worsen the Hashimoto's. So let's talk about the different things that can happen again through menopause. So number one, you have hormonal changes and Hashimoto thyroiditis severity, right? So what you'll see is that you'll see women who are postmenopausal. That means women who've had their last period past, was over 12 months ago, will have higher levels of what we call free and total testosterone, which is really interesting compared to healthy subjects, right? So suggesting that hormonal changes can affect even our testosterone, which can also influence, the Hashimoto severity. Next, you have this cardiovascular impact. So many of you may have heard of the statistics saying women who go through menopause actually now become at equal risk of cardiovascular disease like heart attacks and things like that after menopause. So interesting research when you look at, there was a study showing that euthyroid women, meaning women who have Hashimoto's and were treated with medication back down to normal levels, like myself, show increased arterial stiffness compared to healthy controls. And then that was most pronounced in postmenopausal women. So this estrogen effect is taking something that already put you at risk and then escalating that risk as you go through menopause. And so apparently the menopausal status and Hashimoto's independently contribute to an increased cardiovascular risk. And for someone like myself, I have, my biological father and my mother's father had early heart attacks. One died at 46, the other had his first heart attack at 38. So I have this heightened awareness of familial and genetic risk, also with just being a woman with autoimmune disease and now going through this menopausal state. I'll get to what we can do here in a minute, but I want to talk about it a little bit more. One is sometimes you have some symptoms overlap, right? So symptoms of thyroid dysfunction, such as sweating and joint pain and fatigue, can actually overlap with menopause. So if you're in this menopausal stage or perimenopause, really important to go ahead and have your thyroid checked. So we want to assess a few things there. In addition, women who have a longer reproductive span, meaning later menopause onset, which is typically after the age of 54, you have a higher risk of developing Hashimoto's if you haven't already. So it suggests that this prolonged exposure to higher levels of reproductive hormones may influence the onset of the autoimmune condition of thyroiditis. So now this may beckon to, well, should I be on HRT or hormone replacement therapy? And I'm not a big fan of HRT, that just the verbiage, because that basically says, oh, well, we're trying to get to our estrogen levels and our progesterone levels to the levels that they were before being in menopause. That is unnecessary. When you're thinking about HRT, I wouldn't use blood work to determine if your levels are correct. Instead, it's, what is the lowest dose to manage your symptoms and give you the added benefits that menopausal hormone therapy can actually provide. So there's some nuances to that, but that's not what this video is about. But I really wanted just to highlight again a few things about the research. It shows, again, you can have increased severity of menopause thyroiditis, increased risk for cardiovascular disease. You're also at a higher risk of metabolic syndrome, meaning you're more insulin resistant. Again, this is something that I love to talk about. You will find that you tend to have more midsection obesity as we hit menopause for a variety of different things. You'll have higher triglycerides, potential higher blood pressure, and higher fasting serum glucose. And I will say that my own lipid panel, for the first time ever in my life, I noted after menopause that my LDL, which is your bad cholesterol, actually increased above 100 for the first time, which was crazy to see, right? I was like, whoa, what is my lipid panel doing here? So anyway, I took some measures and now my LDL is back down to where it was before. But I just wanted to highlight, you will see some things happen even if you're following a whole food plant-based diet, even if you're exercising and taking care of stress. There are going to be estrogen occur. Some women have no symptoms, which is phenomenal. I would still highlight, you might want to check those, serum lipids and your thyroid and check your glucose at least once a year or so, just to make sure things are okay. I'm a big fan of assessment and being educated about what's going on in your own body. So what can we do here? There's a few things with evidence that show that you absolutely can see some improvement. There is a correlation. Not everybody with Hashimoto's may have a gluten sensitivity or are at a higher risk for celiac disease. So you might want to check that out. You can do some genetic testing, some other things, especially if you're symptomatic, some GI upset, some different things. Sometimes there's a rash. Again, these are some blood work that can be done. You can also take Nigella sativa, which is an interesting herbal supplement. It has some pretty decent research that will actually decrease your thyroid antibody levels, which is fascinating. Sometimes you can see selenium also improve. So instead of taking a supplement, I'd recommend taking one Brazil nut per week. Will also help your cholesterol. Taking more than that per week could be too much because there's so much selenium in Brazil nuts. And if you don't like the taste, you can blend it in a smoothie or something like that. Again, there's also some other herbal remedies. Acupuncture might be helpful. Now, the herbal treatments, I'm less inclined outside of the, the Nigella sativa, because that's pretty benign as far as side effect profile. There are some other things that I would say you probably want to speak to your healthcare provider about before you jump in and take them, because there's probably less rigorous studies on their showing benefit. There's definitely some lifestyle benefits. There's absolutely benefits showing a Mediterranean type diet. Also, I would say a whole food plant-based diet, having lived that myself, seeing vast improvement with my patients who consume a whole food plant-based diet, because this is an anti-inflammatory diet, right? We're also feeding our microbiome, right? So our microbiome gets healthier. In addition to this, I do want to highlight they need to make sure that you're getting enough iodine. You need about 150 micrograms per day. The thyroid takes up the iodine and helps make thyroid hormone. So let's say that you switch to a whole food plant-based diet and you're salt, oil, and sugar free, which is fine. But if you notice you came back, you're starting to feel a little fatigued, and your TSH, which is a blood marker for your thyroid function, comes back elevated, it may indicate that you have an iodine deficiency. How do you determine if you have an iodine deficiency? You don't do serum iodine, meaning blood iodine, because that fluctuates. So it's a little less accurate than if you need to then collecting your urine. I know, collecting urine for 24 hours. The lab would give you a jug and you collect it. It'll take it back to the lab, and then they'll run your total iodine. And that would give us an indication if you're actually low iodine. If you live along the sea coast, you may find that you're okay. There's some interesting things with iodine and this being around the coast, and then, getting food locally, you may have more iodine in just your foods. And there's some other things, eating sea vegetables. You can take a supplement. You could do also, if you're not salt-free, about a half a teaspoon of iodized salt daily should be more than enough to get you where you need. Maybe you'd be able to go lower than that and have sufficient iodine needs. But again, test, don't guess, as my friend Dr. Khan says. It's a great saying because you really want to assess where you are. Next is stress management. There was an interesting study showing that an 8-week stress management program significantly reduced thyroid antibody levels. So stress, depression, and anxiety in women can improve, right? Lowering your inflammation because you're not causing more inflammation in your body from higher levels of cortisol and the stress. We constantly have this constant level of stress, much more so, I think, in this modern day than we did, 300, 400, 500 years ago. Even though we were a little less food, more food scarcity and things, we have this constant influx of information, and we have also fast food, and we're not eating healthy. We have these ultra processed foods that also cause inflammation, that also disrupt our ability to sleep. We have lights in our faces, even late at night, that disrupts our circadian rhythm. So many quote unquote luxuries of modern life are also to our demise as far as our health, because we're now disconnected from nature, which we absolutely are. Don't forget, we are humans and we're animals, and we are connected to nature. So we need to think about a few things there. Exercise has also been shown to improve not only your insulin sensitivity, but also thyroid. So moving on here, hormonal and non-hormonal interventions for menopause. Again, the hormone therapy, there's some interesting, more recent research showing that there are some actual benefits for more women than previously thought. So that is really exciting. I have so many women come to me and asking about this. It's not necessarily spoken a lot about in the whole food plant-based world. And so I'm going to start addressing that more vocally, more actively, because I see it as a need that's been unmet. So you're going to be hearing more and more regarding menopause, the side effects, what we can do about it, non-hormonally and hormonally, because I think it's important. Remember, this is not just about, only a plant-based diet, or, only lifestyle interventions is all I can do. We need to understand that I should be offering information and education about the array of tools at your feet here. We're very lucky that we have the ability to utilize non-medications and medications, but it'd be like you going to a regular doctor and then withholding anything that be non-medical lifestyle interventions like exercise or a plant-based diet, and not speaking to you that, this might help you reverse your, let's say, type 2 diabetes or improve your lipid panel. That I consider malpractice, and it's doing a disservice for you, because we want to give you as much information as possible so you can make informed decisions for your own body and health. One other thing, there's some interesting research around black cohosh just as a potential herbal remedy for some of the symptoms. And of course, soy is fantastic. I would say I have 2 tiers for soy. If you just look at the isoflavones, that have been very beneficial for menopausal symptoms. I would say on tier 1 are the whole soybean and tempeh. And looking at edamame, you'll see a higher level of the isoflavones that have been helpful. The second tier, which are still very beneficial and helpful, are soy milk and tofu. And so you want to just maybe consider at least trying to do 1 serving a day of the tier 1, and you can do the rest of your servings maybe tier 2. And that is certainly what part of the plan that I've done to help alleviate my symptoms of menopause. So hope you found that helpful. And by the way, I have a free masterclass by the 5 steps to master your metabolism and lose weight. I talk about the 4 biggest mistakes people make in their weight loss journey. And this is a big piece of this, right? So when you think about menopause, you're like, all these crazy things going on. What labs should you be getting, if any? But there are some, right? Because like I said, your lipid panel changes, your thyroid changes, your blood sugar changes. That can affect, 1, your insulin sensitivity, which can lead to weight gain, which is a big piece of the menopausal weight gain. So how do you assess it? What should you know, right? You don't want to be overwhelmed. Sometimes there's just too much information. You're like, I don't even know what to do now. It's like it paralyzes our ability to make a decision because we don't know how to integrate that, right? Next is, how do you personalize that information? And how do you act on it? And how do you make it a habit? So I talk about all that in my free masterclass. I hope you find it beneficial. The link is below. Feel free to share also with anyone that you think that might find benefit. And please don't forget to subscribe wherever you're listening. And again, as always, I appreciate your time. Wishing you joy, love, and peace, and above all, healing, because we all need more of that in our lives every single day. And thanks again for joining, everyone. I really appreciate you as always. Have a great